Hello everyone. My name is Sukhdeep Kaur and I'm enrolled in Hospital Unit Clerk and my student ID is 391113 and today I'm here and I'm going to talk about bone scan for my diagnostic test video presentation. First of all, let me tell you what is bone scan. A bone scan is a nuclear imaging test that is very helpful in diagnosing and tracking several types of bone diseases. It is very helpful in examining unexplained skeletal pain, a bone infection, a bone injury, or abnormal bone growth that can't be seen by a standard x-ray. Means it is very helpful in examining the problems related to bones which we cannot examine by just having a normal x-ray. So it is a good way to view and document abnormal metabolic activities in the bones. For the bone scan test, we have to go through a procedure. For this test, a very small amount of radioactive substance is used, which is known as a tracer. This substance is mainly injected into a vein. It is then monitored for several hours, and it is also very helpful in tracking possible cancer in areas where the tracer has been absorbed by the body. So means it is very helpful in detecting cancer in the body. The whole For a whole body scan, it takes around 3 to 4 hours, as it includes two separate visits. In the first visit, the person is given an injection of a radioactive isotope into a vein. After enough time has passed, the doctor will use a special camera to scan the bones, and if the doctor is not satisfied with the results, he may repeat the injection. But in general, the actual screening procedure takes just an hour. For this bone scan test, the hospital unit clerk has to contact the radiology or nuclear medicine department in order to assign the tests, in order to book the assigned test for the patients. Uh, for this test, a hospital unit clerk has to perform various tasks for the assigned procedure. First of all, the hospital unit clerk has to use a computer to document all the physician orders which has to be completed prior and after the bone scan test. Means he has to update all the information which is necessary to put on the paper. Uh, Instead of this, a hospital unit clerk need to prepare the patient treatment chart so that the assigned doctor came to know about patient's history before performing any test. The hospital unit clerk also need to update the patient's information so that the doctor would so that it would be very helpful for the doctor while performing the test. And moreover, the hospital unit clerk need to schedule appointments for the other patients by keeping the physician's availability in mind. Means these are the tasks which hospital unit clerk has to perform while dealing with this assigned task. For this task, the hospital unit clerk has to consult with various departments. First of all, the hospital unit clerk has to consult with the diagnostic imaging department as for booking appointments for the bone scan test for the patients. Instead of this, the hospital unit clerk has to contact with the medical records departments, as the hospital unit clerk has to type various notes for the physicians, such as recording observations, test results, and administration of drugs. So they have to be in contact with this department. In the end, I just would like to say that this test is very helpful for detecting problems related to bones. It is normally done in the nuclear medicine department of the hospital. For this test, no special preparation is needed, and if any female is pregnant, she just have to inform to the doctor before the scan. In the end, I just want to say that this test is very helpful for knowing the bone related problems, and it is also very helpful in knowing that if a person is suffering from cancer or not. So this all is about my video presentation. Thanks and have a good day. Thank you.